order. Welcome to meeting number 30 of the House of Commons Standing Committee on Health. Today's meeting is taking place in hybrid format pursuant to standing orders. I would like to remind participants of the following points. Please wait until I recognize you by name before speaking. For those participating by video conference, click on the microphone icon to activate your mic, and please mute yourself when you are not speaking. A reminder that all comments should be addressed through the chair. For members in the room, if you wish to speak, please raise your hand. For members on Zoom, please use the raise hand function. The clerk and I will manage the speaking order as best as we can. You can also look at this card that is on the table. One thing, I want honorable members to pay attention here. Crossfire talk is not acceptable because of the health of the interpreters, and the members get the time that they deserve to have. Both sides, not one side. When we have a witness today, sometimes what happens is witness is going a little bit too long. The honorable member want to stop the witness. Please raise your hand. I will stop the clock, so we will not take the time off the members, and let the witness finish, and then we will come back to the honorable member. I hope that is good for you, everyone. Make sense, right? I have done that in the past.
Thank you, Chair. If I understood you correctly, if I'm asking a question and the witness is not answering my question and I want to interject, you want me to put my hand up?
Hand up, and then I'll stop the watch.
Okay.
And then the witness will be able to see, or otherwise I will tell the witness to finish, and then I will not take your time off. Okay? You see what I mean?
I understand what you're saying. It's just different than other committees that I've been at. So I
this is
appreciate you explaining that. Thank you.
Because this is the procedure I used in the previously, and it worked very well.
I'll test it out. Thank you, sir.
Okay? If it doesn't
Thank
work,
you, Chair.
then we'll change it.
Thank you, Chair.
Right? And it's going to be fair to every member. It's not for one person or the other. Okay? Thank you kindly. And now, before the proceeding, I would like to inform the members that earlier today, the clerk circulated a proposed budget of $2,250 for the study of Order of Council appointment of Dr. Josh Reimer, and a budget of $2,250 for the study of the Order of Council appointment of Dr. Harpreet Singh Kosher. Is this the pleasure of the committee to adopt this budget?
Sure.
Good. Carried. So on another matter regarding our meeting on May the 5th, the CEO of Canada Health Infoway is no longer in their role.
Well, what happened? Are you sure?
Let me finish, and that is what it is. That's why I'm saying it, and I mean it. Our members, so the question, because that's not my jurisdiction my jurisdiction is to make sure that I conduct the meeting properly. So are members agreeable to having just the board chair, Peter Vaughan, appear on behalf of Canada Health Infoway? Secondly, Mr. Vaughan has requested to be accompanied by Ms. Tania Ensor to help respond to questions on technical aspects. Is that okay with the members?
No. Point of order.
Yeah,
No.
Mr. Major, you have the floor.
Mr. Green needs to come back.
Okay, any other member?
We did summon both of them. That was the will of the committee. Mr. Green needs to come back.
It is, and there are other members that want to respond, and I have Ms. Chi and Dr. E. Olson.
Thank you, Chair. And thank you for bringing up that matter. I actually don't have the motion in front of me. I just wanted to get clarification if we, did we summon the position or the person?
It is my understanding from the clerk that it was the position, and I'm going to look at that as well. So, because as you know, I just took over the chair, so I don't have that handy, but give me a minute to look at that as well. Dr. A. Olson, you have something to add?
Yeah, I was going to add much the same point. If the motion was to summon the president, and this individual is no longer the president, then it doesn't apply to him.
Only it, because if someone is not officiating as president, if it was not in person, then if the official representing that CEO or I mean, in that chair is not there, so then it will be obsolete. So I have Madam Konas first, and then Mr. Major.
I believe Ms.
Sorry, you want to go first?
No, I was just adding to the list.
Okay, adding list. Okay, thank you.
Thank
Go
you,
ahead.
Chair. I believe that we called Mr. Green because he'd been there for over 10 years. So it's important that we have him and the chair of the board and the board chair is what was summoned. And I believe that was the intent. No matter what it says, I believe that was the intent of the motion.
So I read the motion. Motion does not, so it's in the, to inform the member.
Would you please read that out loud, please, the
Sure.
motion?
Yes, please. I will ask clerk to read it. Clerk, please go ahead. Okay.
That the committee summon the CEO, President, and Chair of Canada Health Infoway, in addition to TELUS Health, to appear for a total of 2 hours together prior to May 6, 2026, to testify on prescribed IC.
So so it's very clear to the honorable member that it was the position that was summoned and it was not the name. And now I will go to the speaking list. Madam Kona, you done?
I just want to repeat that that was the intent of the motion. I think that's the most important part of what's happening.
Thank you. Now, Mr. Major.
So the reason why we invited the people that were in those positions is because those positions went through $300 million in the last 10 years. Mr. Green is exactly the person we need to get in here because he was the person responsible for spending that amount of money with a program that was not working. So to have anybody else but Mr. Green in here is absolutely ridiculous.
I totally understand, Mr.
And that
Major.
is why, and that was the will of the committee, that we wanted to get to the bottom of this scandal.
Thank you, Dr. Stoss.
Thank you, Mr. Chair. I would say that something bad definitely happened at Canada Health Infoway over the last 10 years, and we want to know what it was so that it doesn't happen over the next 10 years. And we need to talk to the person who oversaw whatever that was for the last 10 years, just as the basics of an investigation. And perhaps Mr. Green will be called to court one day, but he will not benefit from parliamentary privilege on that day. So I think this is a once-in-a-lifetime opportunity to get to the bottom of this and for Mr. Green to benefit from parliamentary privilege and speak freely about what actually happened. Thanks.
Thank you. I have the speaking order, Dr. Olson and then Dr. Jezik.
Thank you. Yeah, the intent is not spelled out in the motion. We are bound by our procedures to follow the motion as stated. And the motion stated that the president or the CEO of this organization is here. The named individual is not, Mr. Green is not named in this. He is no longer serving and therefore is not the person to come to committee. It says the CEO, and this person is no longer the CEO.
Thank you. And Dr. Jezik.
Yes, so thank you, Chair. I think we can get the information we need from the board chair. The board obviously fired Mr. Green, and no doubt can explain to us the issues as the board saw it. The board is ultimately responsible for the actions of Canada Health Infoway. So I think with the board chair present, we will get the kind of information that we want in terms of the expenditure, who the funds were given to, et cetera, et cetera. So I feel that's quite sufficient. And of course, as has been pointed out, certainly he was not named in the motion.
Thank you, Dr. Zazik. I'm not going to limit the debate, but we got to see that Dr. Kosher is here if we want to hear him. But I have the speakers list. Mr. Major, please go ahead.
Thank you, Chair. So, okay, so we all understand, we're all here the days when Canada Health Infoway was here, when Mr. Green was here, and TELUS Plus, Canada Health. We all know the intent. Let's not all try to fool this and try to cover this all up. We were all equally frustrated as far as the information that was coming out of those gentlemen and those people that day. So don't give me about this, we're unclear with the intent and all that stuff. I understand maybe you weren't clear, but there was $300 million, and we all discovered that day that was gone, and Mr. Green was totally responsible for it. He couldn't even answer the question of what his salary was. And as we found out, it's over $600,000, and he was paid the maximum bonus for that deplorable program that was just a train wreck. So we all know the intent. So we're all very clear on that one. So, and since he's resigned, I guess, or he stepped down or whatever he's done, he's obviously trying to hide. And I don't know why he would try to hide. I think, like my colleague said here, this is the only chance he's going to get under parliamentary privilege to make clear the record out. So I would move that we summon Michael Green, former CEO of Canada Health Infoway.
Point of order.
This
This is a
motion
matter
is
at
not
hand.
in order because
Why not? It's a matter at hand.
It's a substantial motion.
Check
It
with the
has
clerk.
to have
It's a
48.
matter at hand. It's absolutely in order.
I'm gonna.
We're at the topic matter at hand. We are talking about this. You brought it up.
Point of order. Yes. A new motion this is not on the agenda for today. This would be a new motion which requires 48 hours notice, and therefore to be made today is out of order.
It's not your decision, Doug. It's the chair's.
That's the way I as a chair feel.
So I challenge the chair.
Okay. The chair is challenged. I would ask clerk to take the vote.
Let me get this straight, so we just understand what we're challenging the chair and why he doesn't think, and the Liberals obviously don't think that we should bring back Michael Green because he happened to resign.
There's no debate right now. There is a vote in place, so I would ask clerk to take the vote. Please, go ahead.
Ms. Chi.
Yes.
This is the so as you understand, the chair is challenged. Should the chair be
I
restored?
vote to sustain the chair. Thank you.
Mr. Elson.
I vote to sustain the chair.
Ms. Jackson.
I support the chair.
Mr. Grant.
I vote to sustain the chair.
Mr. Rana.
I support the chair.
Mr. Bailey. Oh, sorry, Mr. Ainley.
Support the chair.
Mr. Bailey.
I do not support the chair.
Ms. Conance.
I don't support the chair as this is a Liberal cover-up.
There's no discussions, please. It's just vote yes or no.
Mr. Mazier,
Yeah, I don't support the Liberal cover-up.
Mr. Strauss,
No.
Monsieur Blanchet-Joncat.
Yes, 6, yes, 5.
So chair is sustained. I'm going to proceed to the witness. Dr. Kosher, you have 5 minutes for the opening remarks.
Thank you, Mr. Chair. I'm pleased to be here today to speak about CFIA's mandate and how the agency is evolving to meet today's challenges. Créé en 1997, l'Agence canadienne.
The Canadian Food Inspection Agency is a scientific agency that works for Canadians' health and welfare to protect our food. And until 2013, the agency was under the Ministry of Agriculture and Agri-Food, and then it was transferred to the the Department of Health. The agency provides advice based on scientific data in its sectors of responsibility.
Work hard to help businesses understand and verify their compliance with Canada's federal regulation related to food safety, plant health, and animal health. This in turn allows us to open export markets for our high-quality Canadian products. Our inspectors, veterinarians, and scientists across the country inspect food for safety risks, protect plants from pests, and respond to animal diseases that could threaten Canada's animal and human health. Le résultat est que les aliments du Canada demeurent conformes.
The result is that food items in Canada live up to the highest food quality standards.
Advancing Canada's interprovincial and international trade agenda, other countries open door to Canadian food products because they trust our system. They trust we are doing our regulatory role well and that our products are world-class. While the CFIA's role is as a regulator, it is industry like food businesses, importers, and farmers that are responsible under federal law for producing safe, accurately labeled food. The CFIA enforces requirements that industry must follow, but also provides clear guidance to help them understand and comply with the rules. The agency takes decisive enforcement actions, such as recalls and monetary penalties up to license cancellation when businesses or individuals do not comply with the federal rules put in place to protect Canadians' plant health and animal welfare. The work performed by CFIA builds trust in Canada's food system. According to this year's public opinion research, 88% of consumers are confident that food sold in Canada is safe. CFIA is continually strengthening its preventative approach to plant and animal health and food safety. This involves constant monitoring, intervention, and emergency preparedness and response, such as in the highly pathogenic avian influenza, where there are threats to Canada's food supply. It is also important to understand that food will never be risk-free. It can become contaminated during growing, harvesting, processing, shipping, storing, or handling. La prise de décision fondée sur le risque est au...
Risk-based decision-making is at the heart of the CFIA. This means that we try to look into the root causes of emerging issues that could threaten food safety, as well as plant health and animal welfare that could have market impacts.
Health approach of balancing health and people, animals and ecosystem, and this is important for addressing global issues such as antimicrobial resistance. At the same time, CFIA also plays an important role in shaping international standards to maintain existing markets and create new access. CFIA is also committed to modernizing its initiative and transform how it delivers on its mandate by removing unnecessary red tape for Canadian businesses and focuses on outcomes. the agency has now started to move towards new business line model, which is focused on food safety, animal health, and plant health, supported by policy, trade, and business enablement branch. And this change will align our organization more closely with risks we face and expectations of Canadians. Going forward, we are focused making our regulations straightforward and practical to meet the real world needs for Canadians and the agriculture and agri-food sector. We will continue delivering clear guidance to business and strong regulatory oversight. This means we aim to make it easier for businesses to navigate the system while maintaining the standards Canadians expect. Thank you for the opportunity, Mr. Chair, and I'm happy to take any questions now.
Thank you, Dr. Kosher. 5 minutes, 15 seconds. That's good timing. So we're going to go to now. Here we go. Okay, good. I have to get my watch, making sure it's clear. Okay. So we will start with Honorable Member Mr. Bailey. Mr. Bailey, you have 6 minutes to go, please.
Thank you, Chair. Dr. Kachar, the reason you're here today is through an accountability mechanism that provides parliamentarians the right to scrutinize and question government appointees and to ensure Canadians have the most qualified people in these positions and are receiving value for their tax dollars through public salaries. Do you think that this is an important part of our democratic process, yes or no?
It is an important part, Mr. Chair.
Thank you. So you would agree with me that the parliamentary scrutiny and holding the government to account is an important function of our system. Would you not agree that shutting the doors and turning off the cameras on committee meetings meant to hold the government accountable directly contradicts their promise to an open and transparent government and raises the clear suspicion that there's something to hide or worse, a cover-up?
Point of order. Point of order. This line of questioning is clearly outside the subject matter of today's meeting.
Thank you. So some of the questions that we are putting it to the...
Did we stop the clock, Chair?
Yes, we did.
Oh, thank you.
Here, that I'm perfect at. So basically, this is not the topic, Mr. Bailey, if we can consider, because the officials are not there to play any politics. So if you can just focus on the subject, I would really appreciate, because I want this committee to go very cordially, and I don't stop people. You know, I gave all the time to any member that wanted on the other issue, this issue, every issue, but please stay on topic. And if there's no other point of order, I'll see if Mr. Dr. Point of order, Madam Konas.
Yes, my point of order is that I believe after what happened in our last meeting that Mr. Bailey might be worried that he might be silenced in the middle of the procedure here if it's something that the Liberals members don't want the public to hear.
No, that will not be the case. He will get his time. He will be able to focus on the subject that we are studying today, and he would have every right to ask the related question on the study to the witness. Thank you. Thank you. So with that, I will go back to Mr. Bailey. Please go ahead.
Thank you, Chair. The Liberal government claims it wants to build Canada and protect our sovereignty, and yet their actions show the complete opposite. When it comes to agriculture and protecting our food security, the Liberals are running backwards. I'm sure you're well aware of the agriculture research centres closures across Canada, including the one in Lacombe, close to my riding. If you were approached today by the Agriculture Minister for advice about closing the research and development centres, what would your position be?
Thank you, Chair, for the question. Agriculture research centres are the centres which are under the purview of Agriculture and Agri-Food Canada, and I don't have any mandate in terms of advising the Minister on that one.
Okay, Mr. Bailey, go ahead, please.
I guess I'm asking what the long-term risk to Canadian food sovereignty and regulatory independence caused by the Liberal government's decision to gut domestic research capacity.
Mr. Chair, as I mentioned earlier, there are multiple ways how we look at our regulatory frame, and some of the research which is done everywhere. So I am not in a position to comment about agriculture and agri-food's decision on that.
Mr. Bailey.
On changing the mandate of the Canadian Food Inspection Agency and the Pest Management Regulatory Agency, now called the Pesticide Regulatory Directorate, PRD, to incorporate economic variables in their decision-making, it is yet to be completed. It was announced again in this week's Liberal Credit Card Economic Update that their mandates would change to consider food security and the cost of food. There seems to be pushback from your department to actually move forward with this mandate change. Your VP of Policy and Programs, Robert Inero, was asked point blank by MP John Barlow at the Agri Committee whether the department was changing its mandate to meet the promises made by the government, and he said that the change isn't required. When will the CFIA and the PMRA mandate be changed to consider food security and the cost of food in their decision making?
Dr. Kosher.
Thank you for the question. So in terms of CFIA's role, I will stick to that. I am not responsible for the PRD. The strategy which is going to be used in the National Food Security Strategy will make easier for Canadians to access affordable and nutritious food. And it will actually increase and build Canadians' resilience to the capacity to meet domestic needs. One thing which is very clear about the security of the food is that CFIA...
Honourable Billy.
In announcing the name change of the Pest Management Regulatory Agency to the Pesticide Regulatory Directorate, your department used the motto, different name, same spirit. That doesn't instill much confidence in me or in the stakeholders and businesses that will be interacting with your agency going forward. If nothing has changed internally except the name, when will the mandate eventually change? Like the measures are you putting in place to change the activist culture that's festered within your agency and made it harder for Canadian businesses to operate, grow, and succeed in this country?
Mr. Chair, very respectfully, PRD is not under my purview and my authority. It is a division of Health Canada, and those will be responsible for answering.
Since 2015, over $1 trillion in investments have fled Canada, according to RBC. While the Canadian Federation of Independent Businesses report agriculture has seen more businesses exit than entries for the past decade, largely due to the heavy regulated burden and red tape at CFIA. The Agriculture Committee recently issued a strong report calling for urgent CFIA reform. Your government's response was widely criticized as weak and inadequate. CropLife Canada stated it fell well short of matching the level of urgency and ambition in the committee's roadmap for growth and competitiveness, ranking 32nd out of 38 OECD countries on regulatory burden and 36 on licensing and permits. Your department's response listed only measures that were already completed and underway. With over 300 outstanding regulatory irritants identified by the agriculture and food sector, what exactly will they be eliminating?
Dr. Kosher.
Thank you for the question again. I think if we go back to the red tape reduction, CFIA is making excellent progress on reducing the red tape. And I would point out that red tape reduction progress report is on CFIA's website. What we have done is reduce the regulatory burden and administrative burden. There were 26 actions which were identified. 92% of them, which is about 24 out of 26, are either complete or on track to completion. And this remains our priority. And there are multiple ways I can explain that there are benefits. For example, Canada's enhanced feed ban, exempting low-risk fertilizers, products from pre-market registration, and there are multiple others which are helping the Canadians in their own way by reducing the regulatory burden.
Mr. Bailey, you have 10 seconds.
I'd like to thank the doctor for answering my questions. Thank you, Chair.
Thank you, Mr. Bailey. Now we will go to the next member, Dr. Zezik, for 6 minutes. Please go ahead.
Thank you so much, Chair. and through you to Dr. Koshar. It's certainly a pleasure to see you in this position. Congratulations on becoming the president of the CFIA. Having known you and know something about your background, I know that you're extremely well qualified for the position. Having said that, and to follow up somewhat on what Mr. Bailey was talking about, the Spring Economic Update announced the government's intention to amend the Canadian Food Inspection Agency Act and the Pest Control Products Act to include consideration of food security and the cost of food. So, could you please enlighten us what exactly, in practical terms, does this change mean? How will things be different? What are you going to be considering?
Thank you for the question again, Chair. Chair, the two things which I would say are, one, that it is about supporting the food affordability for Canadians without compromising health and safety of Canadians. That is an important piece for us. When we use the economic lens, that is what we are trying to achieve. Although we have been in CFIA regulations and in our regulatory stance have always considered economic impacts on that, but this amendment, which will be tabled in future legislation and will be scrutinized and studied in the parliamentary process, will actually build that as a part of our future. I have to give you one simple example. We have created amongst us a business enablement group, which is going to be assisting Canadian entrepreneurs who are looking for getting up to the federal standard of safe food for Canadians license, and we are giving white glove service and concierge service to help them get to that point, giving them an economic kind of a guidance, which is much more necessary rather than just an enforcement role.
And so I presume there will be broad consultation with stakeholders. Could you maybe elaborate on those sectors that you're particularly interested in hearing from?
Thank you, Mr. Chair. Again, as I mentioned, this is going to be in the future legislation. And so we have a elaborate plan for consulting with the stakeholders who are from different parts of industry and touching the food safety, animal health, and plant health also. Given the fact that food is derived either from plants or animals, so food of plant origin or food of animal origin, we are actually casting a wider net to get information, get engagement, get the consultation going, and then presenting it through the studies through the parliamentary process.
And during your presentation, you mentioned regulatory modernization. This sometimes worries people that either they're going to be some sort of glitches in terms of possibly new software programs or whatever. So how exactly are you considering to make processes more efficient, more predictable, more responsive? Can you elaborate a little bit on what you're looking at?
So, Mr. Chair, that is again one of the things which we have started to put in play, which is how do we evolve with the time in terms of modernizing the way the regulations are built? As I mentioned earlier in my opening remarks, in 1997, this agency was created. We have had multiple iterations where we have increased our oversight and regulatory role has evolved. We continue to do that by making sure that we are modernizing our acts and legislation onto that. I'll give you a simple example. There has been an enhanced feed ban, which was created at the time of BSC in Canada. However, as we move to a negligible risk status, meaning there is no risk, very low risk, I should say, to humans and to transmission of the BSC to Canadian cattle, we have now started to look at modernizing that and evolving it to allow certain specified risk material in there. Another good example is seed regulation modernization, because seed modernization is something where we have consulted extensively and looked at the legislation, which is many, many decades old, and we're trying to actually formulate those where we can bring them in line with today's modern industry standards.
So going forward, you will look at some of these perhaps outdated processes one by one systematically to ensure that they fit today's world.
Mr. Chair, that is absolutely the vision here, to look at the regulatory frame which should fit in how we can help the Canadian enterprises and the businesses to benefit from their agri-food businesses which they have.
20 seconds.
I think I'll just cede my time. Thank you.
Thank you very much, Dr. Jazik. We will now go to Mr. Blanchett Jonka for 6 minutes. Please go ahead.
Thank you, Mr. Chair. I'd like to thank Mr. Kochar for being with us today and congratulate him on his new position. The employees of the Longueuil Laboratory, of the CFIA laboratory, were informed of the laboratory closure by the end of April 2026, but according to public information, the laboratory was to shut off at that point in time. We had a colleague of yours at the Health Committee who was telling us that this would create no risks and no consequences, and they undertook to answer our questions and give us the analysis that led to the decision to close the laboratory. Now we're at the end of April, but a couple days ago we had news that the closure has now been pushed forward to March 2028. We're trying to understand what has happened with this Longueuil laboratory. Could you please confirm to us whether the lab will now be shut off by April 2028, yes or no? Thank you for the question. Mr. Chair? In the comprehensive expenditure review, the CFIA decided to end the activities of the Longueuil laboratory by March 2028. It is indeed the case.
Look at how we can consolidate the work which is done there. For example,
for instance, food allergen testing. You have answered my question. It was yes, so I'll have another question. Now, why are you postponing the decision to close the laboratory to March 2028 if the analysis was solid in the first place?
Things which we have done over time is that since it is up to 2028, this is a 3-year comprehensive expenditure review. We have planned it in such a way that it would actually go into March 2028. Hence, we have actually used our ability to allow the people to continue to have an employment up to that time. And in between that, we will do the planning as well as a reprofiling of this work to all the other laboratory networks which we have.
Okay. So I'm trying to understand. You seem to agree with your colleague who testified on March 12th. They were saying that all of the expertise at the Longueuil laboratory already existed in another laboratory in the country. Is that the case?
Mr. Chair, I do need to mention this thing that there is work which is done in different laboratories. As I said, there is a laboratory network which we have. And I'll give an example just for the ease of it. Longueuil Lab detects marine biotoxins. And we have a capacity in Burnaby and Dartmouth, again, who perform the similar tests. So basically moving the work over there would be an important piece for us, and we are planning onto that. Similarly, allergen testing is also conducted in Burnaby Laboratory and other Western laboratories, so we'll use that laboratory network. There will be other things which we may not be able to immediately kind of identify and which may not be in the mandate, and we are working towards that in a planning way.
Monsieur Cochard, pouvez-vous être plus précis dans votre réponse?
Could you be more specific in your answer? Because the closure of the center is being delayed. It's not just to transfer the employees. Can you please explain to us what led to this decision to delay the closure and the announcement only coming a couple days before the originally planned date of the closure of this lab?
Mr. Chair, I need to respectfully mention this thing that the intent to close the Longueuil laboratory, our part of Longueuil laboratory was in 2028. The letters which were sent out were actually sent out as surplus. However, realizing that that creates an anxiety, and although the date was in 2028, we have moved it to affected status, which means that they will still have an employment continuing on. Longueuil Laboratories, the CFIA operation is going to be closed. The laboratory belongs to Health Canada. Those other aspects in Longueuil Laboratory will continue to happen.
Monsieur Cochard, pourquoi les analyses?
Mr. Koshar, on March 12th, we were promised to receive the analysis leading to the decision. Why haven't we still received this analysis?
I would say that we could actually provide you with a bit more concise response to that in a written format, if that is what is being asked for by the committee.
Ça va me faire plaisir, Monsieur Cochard, de vous.
I will happily help you out, Mr. Chair. I'm going to move the following motion that the committee requested information more than a month and a half ago, and we still haven't received the information. I think it's important that people are reassured when it comes to food safety. So in order to get to be able to see the large picture, I will read the motion. Pursuant to Standing Order 1081, that the committee instruct the CFIA to provide in the next following 28 days the following documents. 1, all of the analysis and evaluations, scientific opinions, and risk analyses for public health, as well as preliminary and final analyses that led to the closure, delay, the suspension, the modification of the Longueuil laboratory. 2, capacity analysis and activity transfer planning to other laboratories, especially with regard to food allergens, nutritional analysis, and marine biotoxins. 3, all internal correspondence or external correspondence related to this decision, including communication with the Ministry and Health Canada. 4, the analysis on Canada's international obligations and export markets. 5, all operational continuity analysis and risk management activities. 6, a complete chronology of the events leading to the decision, including the sending of the letters to the employees. Also, the information available at the appearance of Mr. Yaniro at the Standing Committee on Health on March 12, 2026, and all assessments having led to the closure decision with regard to the Longueuil laboratory.
Clerk does not have the motion, but I have speakers list that I have to honor. Mr. Major, please go ahead.
Thank you, Chair. Thank you to the member for introducing this motion. I guess this is this is how transparency is going to work. I can't believe you're actually having to put this through a motion in this committee to actually take up our time to actually just beg for information of what's going on here. And I congratulate you wholeheartedly in doing this. And I mean, this is after 10 years of a cover-up, right? I mean, the Liberals have had how many years to do this? Even the new government has had, supposedly, they call themselves a new government. How many years, right? A year to come up with this information. Unbelievable. And we'll see what happens here, but I wholeheartedly support this motion. And hopefully we'll get to the bottom of get some answers to your questions.
Thank you, Mr. Major. Madam Konas, then Madam Chi.
Following up on that, just want to support the fact that when we as a committee are asking for information, transparency, that we receive that information, those documents, there are many, many documents that we have ordered as a committee that we have not received yet or that were voted down by our Liberal colleagues. It's important that we receive as many documents as we can so that we can let Canadians know how their dollars are being spent, particularly in healthcare, which is obviously through the year here, through our first year as a committee, we see that we are lacking in so many things as doctors, health clinics, specialists. So this is important. Any document that is required or is asked for by a member should be voted by this committee to be received.
Thank you. Madam Chi, I just want to clear to the honourable members that the clerk has not received the motion, the text of the motion. So, Madam Chi.
Thank you, Chair. And I thank my colleague for bringing forward a motion. Just based on what I've heard, it is a fairly substantive motion, and we haven't had time to read it over yet from our side. It would be great to consider that once we've consider the clauses within the motion. I think the honourable member online will also agree with that, and I think folks around the table will agree with that. When we are studying, when we are considering matters at hand, it'll be great to see them, especially when they're substantive. We do have witnesses here today. We just got through, we barely got through one witness, and there's another witness waiting in the committee room. So I think with respect, out of respect for our witness today, I move to adjourn the debate.
Take the vote, please. It is to adjourn the debate on the motion.
Ms. Chi,
Yes.
Ms. Elson,
Yes.
Ms. Jaczek,
Yes.
Mr. Headley,
Yes.
Mr. Grant, Mr. Rana,
Yes.
Mr. Bailey,
No.
Ms. Gonans,
No.
Mr. Mazier,
I vote no for the cover-up. For the cover-up.
Mr.
Please.
Strauss,
Mr. Major, don't make my life harder, please.
Monsieur Blanchet-Jonca, Monsieur Blanchet-Jonca,
Non.
carried.
The motion is carried. I'm going back to the witnesses now. I have the next round. I will go 3 minutes, 3 minutes, minute and a half, 3 minutes, 3 minutes.
Simplement, Monsieur le Président, simplement vous informer que
Mr. Chair, just to let you know that I had some speaking time left.
Yes? 2 minutes? Okay. So you have 2 minutes left. So I thought it was 6.
merci de respecter mon temps, Monsieur le Président.
Thank you for respecting my time, Mr. Chair. Mr. Kochar, if we can't get answers from the government, well, there is a former executive of the CFIA who said that closing the Longueuil laboratory while maintaining food safety would be unrealistic. Would you agree with that statement?
Mr. Chair, I would say that the whole mandate of CFIA is food safety, and that is our top priority. We do not compromise on food safety or animal health and plant health. So any of those decisions are taken into consideration, keeping in mind that there are other programs or other ways so that we can reduce redundancy and duplication and still deliver for Canadians.
Monsieur Cochard, est-ce qu'en date d'aujourd'hui, il existe un laboratoire?
Mr. Kochar, is there another laboratory in Canada other than the Longueuil laboratory that has the same level of expertise?
Mr. Chair, we have 13 laboratories in CFI, including Longai Lab, and we have varied expertise in different labs. I mentioned Dartmouth Lab, the Burnaby Lab, where we can actually have a similar testing done. And if there are things which we believe that they are not in the mandate of CFIA, then we will have to kind of look at what industry, provincial labs, and others who are also partnering with us in any of these situations.
Oui. Monsieur Cochard, les analyses de biotoxines doivent être complétées en 72
Mr.
heures.
Koshar, the biotoxin tests need to be done in a fairly narrow window. Could you confirm to us if after the Longueuil lab's closure, there are other labs that can turn over these tests within the time delays?
Mr. Chair, I would say that we are very cognizant of this fact that these marine biotoxins have to be tested in a very timely manner, and we are working towards making sure that service standard does not go down.
Merci. Combien de temps de votre côté, Monsieur le Président?
Thank you. How much time do I left?
Merci beaucoup. Donc, Monsieur Cochard.
Thank you very much, Mr. Koshar. The increase in transport distance, of course, is a risk in terms of the analysis of samples, as you know. So having a laboratory in Burnaby, could that be a risk from that logistical point of view?
Mr. Chair, as I mentioned earlier, there are multiple laboratories. Two of them, which is closer to Longai, would be Dartmouth Lab, where we also do the marine biotoxin. But as I mentioned earlier, we will take every care so that we do not actually have a reduction in our services in terms of laboratory testing.
Thank you. You have 8 seconds. It's almost done. Thank you very much, Mr. Blanchett-Jonka. So I will give a short round now on the next one. We will have 2 minutes, 2 minutes, 1 minute, 2 minutes, 2 minutes. So we'll start with the Madam, because he was here till 4:30. So we have another witness coming in. So I have to accommodate that witness.
Yeah, we started 15 minutes late.
So that's why I'm going to 15 minutes. That's where I will go to. That's the way I'm counting numbers. So
Quick check, see where we got left for resources, please.
we will do that, but right now I'm not going to waste any more time. I'm going to give 2 and
Okay,
1,
I'm up.
2. What? Yeah, it's Madam Konas is up. Okay.
Mr. Koshar, earlier today, I was at the Trade Committee with the president of the Canadian Cattle Commission, and he described the infrastructure bottlenecks limiting our trade exports. He was concerned that there's not enough capacity or hours of CFIA's veterinarians when it comes to measures such as restricted feeder cattle from the United States getting to Canadian slaughterhouses, among other issues. We need now, of all times, to remain competitive. Given the intention among all parties to see more markets open up for Canadian beef as well as other meat products, how is CFIA going to avoid continuing to be a regulatory bottleneck to getting goods to market as we're finding increased demand?
Thank you, Mr. Chair. And I take the point that this has been flagged that a CFIA, veterinarians or others are unavailable, but however, we do strive to actually provide the service as quickly as possible. We have moved to also digitization, where the certification is all done in that regard to help them get there.
Mr. Koshar, how many veterinarians has the department lost in recent years compared to how many you're recruiting? Just a number.
I would say that we currently have, Mr. Chair, around over 500 veterinarians who are working for CFIA. There's a continuous, people do join CFIA and then retire or leave, but that's 500.
Mr. Kosher, can you table with the committee how much you've collected in fines from cattle ranchers in the last fiscal year, and an explanation on how the new traceability requirement will affect them?
7 seconds to respond, Dr. Kosher.
I
Will
don't
he
have
thank
those.
that? He'll need to table
Okay,
it.
thank
later.
you.
Yes.
The time is up, and we will go to Madam Chi. Madam Chi, you have 2 minutes.
Thank you, Chair. I'll share my time with Dr. Henley.
Okay, Dr. Hanley, go ahead, please.
Thank you, Mr. Chair. Dr. Kochar, congratulations on your position, and thank you for being here. Hopefully I can get 2 quick questions, and neither really is quick, but we only have a certain amount of time. I have heard from one of the local egg producers in the Yukon about more difficult access to CFIA inspection, and I wonder if you can comment on that. It's always been challenging. We did have an inspector in Dawson Creek down the highway, quite a long way. I believe that position is no longer intact, and I'm just wondering if you can quickly comment on that access to inspection for the more remote areas in the country.
Mr. Chair, our intent is to provide timely service to all Canadians who require the service from CFIA. We have, as I mentioned, looked at our consolidation of where we have our inspection services. We do provide service at a regular basis. It may not be actually in the specific area, but we do regularly provide that service. As I was mentioning earlier too, that most of the things are becoming more digitized, so we are able to provide more access to the people for looking for certification and other things through online portals also.
30 seconds, Doctor.
Just, I'll leave the other question, but can you elaborate on how online inspection would work for, say, a poultry farm?
So I would not say the poultry plants are actually assessed by inspection, but they are like certification for pet exports, movement across, or there are others where cattle farm animals are moved across the borders or actually exported. So we do have a way how, for example, for Canada and Mexico, we have done.
Dr. Kosher, sorry, I have to cut down in essence of time. So now we will go to Mr. Blanchett Jonka for 1 minute. Please go ahead. You're on mute. You are on mute, Mr. Blanchett. Yes, go ahead, please. I will not take your time.
Thank you, Chair. Just to clarify, did you say 2 minutes for everyone or 1 minute for myself?
2 minutes for the others.
OK. Bon, d'accord. C'est pas ce que vous avez mentionné un peu plus tôt, Monsieur le Président. Vous avez dit à 2 minutes.
I think you said 2 minutes for every party.
Please, 1 minute. I'm not. Please, let's
sortir
focus.
l'enregistrement, on pourra s'en reparler, d'accord? Monsieur
We can
Cochard.
go back and listen to the recording. Mr. Kochar, so you were talking about the transition plan. So the transition plan, was it completed when the first decision to close the Longueuil lab was made?
Mr. Chair, the transition plan was discussed. It was not during the time I was there, but there was discussed, and there is a plan in place. It has to be refined as we move forward with where other components of the testing of Longueuil Lab are going to be. But we have a fair idea of where it would go in terms of testing.
Okay. On ne remember pas là, Monsieur Cochard, mais est-ce que le plan de
So the transition plan, did you underestimate what the work that needs to be done? Because you were talking about a 2-year timeline.
Just to say, Mr. Chair, that I had earlier mentioned the intent was always to close the lab in 2028. It is a 3-year process of comprehensive expenditure review, and that's how much time we needed to actually transition, and that's why we have given this fair amount of time to the individuals who work in the laboratory.
Thank you. Now we will go to Mr. Major for 2 minutes. Please go ahead.
Thank you, Chair. Dr. Kosher, welcome. 587 job cuts have been confirmed in the CFIA as part of the expenditure review. How is this affecting services related to food safety and inspection?
Thank you, Mr. Chair. So we have actually looked at the workforce, but let me assure you, first of all, there has been no cuts to the frontline inspection staff. What we have seen is the
Okay, yeah, I'll go back. Okay, got another
Okay,
question for you.
Mr. Major.
The Canadian Veterinary Medical Association says Canadian veterinarians have lost access to 40% of the drugs they had in the 1980s. In part of regulations are making it's harder to get the drugs to market. You are a veterinarian yourself, so I want to know from your health and safety perspective, is this concerning?
keep my professional title on one side, but in terms of the...
Excuse me, sir, but that's very important fact. That's a very important fact, that you have the professional opinion.
I do, but I wouldn't want to speak, Mr. Chair, on behalf of Health Canada, who's the regulating authority for the veterinary drugs.
Okay.
Thank you, Dr. Kosher. And Mr. Major, as I mentioned earlier, I stopped the watch. If we can't go crosstalk, it will be easy on the interpreters. So,
Yep.
Mr. Major, go ahead.
Dr. Kosher, how many vacant veterinarian positions does the CFIA have today?
I'll have to come back to you. I don't have that number.
You can table that information then, please?
Yes, I will.
And then how many CFIA veterinarian positions at slaughterhouses are currently vacant today?
Mr. Chair, we have 100% presence at the slaughterhouses, so the veterinarian positions are always there.
What province has the highest vacancy rate for CFIA veterinarians?
Dr. Kosher.
I'll again have to come back to that. That data is not in front of me.
Mr. Major.
How many times has the CFIA had to reduce, delay, or cancel inspections because no veterinarian was available during that in the last year?
Dr. Kosher.
Mr. Chair, that is a very rare phenomenon where we have to cancel. We generally plan everything with the industry.
Your time is up, Mr. Major.
If you could table that,
Thank you
too,
very
that'd be
much. We'll go to, right now, Dr. A. Olson for 2 minutes. Please go ahead.
All right, thank you. Thank you, Dr. Kokar. We're talking about diversifying our, markets, and what is your strategy for helping to, with your agency assisting in, diversifying our markets so that there's better market access for our agricultural products abroad?
Mr. Chair, let me start by saying Canada's ability to export food or animal and plant products is based on a very strong foreign regulators' confidence which they have in Canadian regulatory inspection system, certification system, and oversight system. So CFIA provides that oversight, and we do have the ability to actually have a system verification with our trading partners. They come in here and verify our system, assess our system, assess the establishment, for example, for the meat, and that gives them the confidence. And we continue to build that on, and we are trying to expand more markets. We have multiple markets which have been lately opened up.
All right, thank you, sir. How much time do I have left?
You have 45 seconds.
Okay. As part of that as well, part of our government's mandate is to reduce interprovincial trade barriers. And could you explain how CFIA will help to work to support, internal trade within Canada?
Mr. Chair, internal trade is specifically in terms of, to look at that, almost 61% of the food produced in Canada is actually moving around in the provinces. There are some parts where there is a little bit of a piece where we have to get the producers to the Safe Food for Canadian regulation level or license level. I will say this thing that we have actually been able to give exemptions, for example, unmet slaughter capacity. If there is a slaughter facility which is across in, let's say, Ontario, and the Quebec have to move it 500 kilometers, they can use that exemption for that. So we're using a lot of that to help them get to that point.
Thank you very much. On behalf of the honorable members of the committee, I would like to thank Dr. Kosher for your time today. I will briefly suspend the meeting and we will welcome the second witness. Suspended. Point of order.
Mr. Chair, this is going back to the last hour. There was a motion presented that we bring back Mr. Green from Health Infoway. Hang on, this is a point of order. So what I'm asking is, you turned to the clerk and asked her to advise if the point of order, the motion was in order. I want to know what advice the clerk gave you. That's all I want to know.
The only advice I asked from the clerk.
I'm not asking for the decision. I am asking for what the advice.
I totally understand your point. First time, Mr. Mazier, as I said earlier, I'm gonna tell you, I asked her whether Mr. Green was invited by name or by title. And that is exactly, she showed me in bold letters that it says not, it's by designation.
It's not what I'm asking, Chair. I'm asking if my
She did
motion
not-
was in order.
That was my decision. Every decision that I make
So
is my
she
final.
advised you it was in order then?
It's not her. She did not advise me. I cannot.
You did. You conferred.
No,
You
listen,
asked, like, it's on Hansard. Like, you conferred back and forth.
But
so
conferred
all of my,
means-
so
listen.
I ask you, what did the clerk advise you? Was it in order or not?
I did not ask that specific question. I asked her.
Can you ask her now?
I'm not going to ask her now. This is my decision because I looked at it and I looked at it that it was not by name, it was by designation. So it's not her decision, it is my decision, and let's move on. Thank you. Pursuant to Standing Order 111 and the motion adopted by the committee on Thursday, April 16th, 2026, the committee shall commence its study of order in council appointment of Dr. Joss Reimer to the position of Chief Public Health Officer of Canada. On behalf of the committee members, I would like to welcome Dr. Reimer for the second hour. So, Dr. Reimer, you have 5 minutes to open statement.
Thank you, Monsieur le Président, Mesdames et Messieurs les députés.
Mr. Chair, honorable members, thank you for the invitation to meet with the committee today. I am honored to be here in my new role as Canada's Chief Public Health Officer, and I appreciate the opportunity to speak with you early in my mandate. I assumed this position on April 1st, following my appointment by the Government of Canada. I am a public health physician, the former Regional Chief Medical Officer for the Winnipeg Regional Health Authority, and past President of the Canadian Medical Association. In these roles, I have learned that public health works best when decisions are informed by scientific evidence, collaboration, and community. I look forward to listening to and learning from all partners and stakeholders, and to bringing my experiences to this new role at the federal level.
As the Government of Canada's lead public health professional, my mandate is to provide independent, science-based advice to the Minister of Health and the President of the Public Health Agency of Canada. To do this effectively, I will collaborate with partners across jurisdictions in Canada and internationally on public health matters. I will also speak and engage with Canadians, health professionals, stakeholders, and the public on population health issues. And finally, I will report annually to Parliament on the state of public health in Canada. I have had a busy first few weeks listening and learning from the agency senior leaders about their ongoing work, challenges, and priorities. I have also had meetings with the Minister of Health and the President of the agency and discussed priorities and expectations for my mandate. I'm also focused on building strong relationships with federal, provincial, territorial, and Indigenous public health leaders. I have had the opportunity to attend my first Public Health Network Council meeting as federal co-chair last week. And one of the issues we discussed was emergency preparedness, and specifically on strengthening operational readiness and coordination. This week, I had the honor of participating in the launch of the Pan American Health Organization's annual vaccination week in the Americas, which was held here in Ottawa. It was an opportunity to both celebrate the life-saving impact of vaccines, but also discuss how we need to sustain the progress and the challenges that we face. Immunization is a deeply personal topic for me. In Manitoba, I was responsible for the COVID-19 vaccine rollout. And in addition to that, I grew up in a rural community where at one point in the last 2 years had the highest rate of measles in the Americas. These issues matter to me and play a major role in why I decided to take on this position. During my mandate, I look forward to collaborating with colleagues and partners domestically and internationally, and with communities across the country to address pressing health concerns, as well as addressing health equity. This is a consequential moment for public health. Canada faces a convergence of challenges: the reemergence of vaccine-preventable diseases such as measles, the ongoing toxic drug and overdose crisis, persistent health inequities, including for Indigenous peoples, and growing risks linked to extreme weather events and emerging infectious diseases. At the same time, public trust in health institutions has been strained following the pandemic. Earning and strengthening trust is central to my approach. I will support the delivery of public health advice and information that is transparent, consistent, and reliable. To achieve this, I will work closely with partners and experts to address health myths and disinformation. Je mettrai également l'accent sur le renforcement.
I will also place emphasis on strengthening prevention and preparedness, addressing infectious diseases, and reinforcing global health security, as well as supporting efforts to encourage innovation and strengthen basic public health functions like disease surveillance. I am incredibly honored to take on this role, Mr. Chair. I look forward to working with this committee and partners across the country to protect and promote the health of people in Canada. Thank you, and I will be happy to answer your questions.
Dr. Reimer, and we will go to Dr. Strauss for 6 minutes. Please go ahead.
Thank you, Chair. Thank you, Dr. Reimer, for being here today. Thank you for your opening remarks. I had it in my head that you and I agree on a number of things, that, for instance, medical misinformation can be dangerous, can harm patients and populations, that measles vaccination in children is very important. You didn't say so in your remarks, but I imagine you would agree with me that it's a bit of a gut punch that Canada's lost its measles eradication status. So would you agree with that?
Dr. Reimer.
Yeah, thank you so much for the question. And I would agree that we do agree on many points, including that losing the measles elimination status was a very disappointing thing to happen in Canada.
Thank you. I suspect that we also have an agreement that it's really important that Canadians have trust in public health institutions and that public health institutions work to build that trust with Canadians. And I suspect that if you and I were to discuss at great length, we might find that we have some areas of disagreement there. But just to open it, I would ask, has measles vaccination rates throughout Canada, and I'll be open, in the region that I served as a public health officer, I'm sure they went down, although good data wasn't even being taken at that time. But in the region that you served as a public health officer, did measles vaccination rates go down over the time that you served?
Thank you, and thank you again for the question. We have seen a decrease in childhood vaccine uptake across the country. There's certainly variation in different regions, in different communities. However, I would say that across the board, for a variety of reasons, there has been a decrease, which contributed in part to what we're seeing with measles right now in Canada.
Yeah, and could you share with me your reasoning for why that happened?
I think that there's a number of things that happened at the same time. As I mentioned, there certainly was some distress that occurred during the pandemic. For people who were experiencing the decisions that public health made, whether those were the right or the wrong decisions, we know that there were many difficult things that people went through: losing income, losing access to friends and family. Other individuals lost loved ones, and across the board, it was a really difficult time.
Okay, so I'd actually say that's more agreement between you and I than I may be expected to attain. But when you say whether they were right or wrong decisions, I guess, would you agree that some of the decisions in some of the jurisdictions were wrong decisions?
Thank you. During the pandemic, I know that public health professionals were working their very hardest to make the best decisions they could for their individual communities and for the country as a whole.
But surely they weren't batting 1,000.
If you can raise your hand, please, that way it will work better. Sorry. And Dr. Reimer, go ahead, please.
I have no doubt that we as public health professionals did not function perfectly. However, I do believe that we made the best decisions that we could with the information that we had at the time and with the goal of the best outcome for Canadians as a whole.
So in service of our shared goal of increasing public health in institutions, do you think that public health authorities specifying when they got it wrong and perhaps expressing some amount of humility or even contrition around those points may be in order in terms of building trust?
Yeah, I think you bring a really valuable point, because something that I heard back from Manitobans when I was doing the vaccine rollout very clearly was how important it was to them that I was transparent and that I expressed both what I knew, but also what I didn't know. And when we changed our approach, giving them an explanation as to why, and often it was because of new information. And so I want to take that into this mandate as well, to make sure that when Canadians hear me speak about a topic, that they can trust that I'm going to share both what I know, what I don't know, and where we change approaches, that I have an explanation about why we changed.
Yeah, so, and then maybe on some more specifics. It's my understanding that many, although I'm not in the field anymore, that many public health authorities in many European countries no longer recommend COVID-19 vaccination for healthy children under 18. It is my understanding, last I checked, that public health authorities in Canada do recommend that. Can you speak at all to that discrepancy?
I think within public health recommendations, we rely on the National Advisory Committee on Immunization, which is an independent body of scientific experts who review all of the evidence that is available and come up with recommendations for Canadians. And so because they're an independent body, they provide excellent advice to us. The decisions about what is covered and offered in each province or territory is made by those provinces.
So I'll be totally open with you. When I was serving as a public health officer, people would tell me things like, I am not going to get this vaccine so long as I feel that you're forcing me into it. Or they would tell me things like, fine, you've convinced me to get the vaccine, but there's no way in hell you're vaccinating my 16-year-old. And then when I look at frankly, I think coercion that was used with respect to vaccine mandates, and the fact that multiple public health authorities in other countries have kind of stated that the risks, in fact, outweigh the benefits for healthy young people, I think that is a source of profound and ongoing loss of trust. And until that's acknowledged, I don't see that being repaired. So I'd like to know what reflections you have on that, but I just want to raise it as you go forward in your mandate. Like, there is an important lack of trust here, and I think it needs to be dealt with.
Dr. Reimer, you have 25 seconds to respond.
And I really appreciate those comments. It, as I mentioned, was a really difficult time for everyone. And when we work in public health, we are always trying to balance the benefits and harms of any intervention, as opposed to when I'm caring for an individual patient and I can think about their needs above anyone else's. When you care for a community, you know that the decisions that you make may help some people more than they help others, and that's a difficult balance to take. And at all times there will be some people who appreciate the decisions and others who do not. And that's something that I take very seriously, and I know that the Public Health Agency of Canada takes very seriously, that the decisions that we need to make will always need to balance benefits and risks for all Canadians. And that's what makes the job difficult, but also what makes it so important.
Thank you, Dr. Strauss. And we will go to Dr. A. Olson for 6 minutes. Please go ahead.
All right. Thank you, Dr. Reimer. And once again, congratulations on your appointment. You know, I share with you the very personal relationship with vaccination, and particularly during the pandemic. I worked pretty much through the entirety of the second wave of COVID, which hit Manitoba very hard. I spent that time working in the intensive care unit. And one of my personal observations is that in a 6-month period, I think I saw more preventable death than I saw in the previous decade of my career. It was a very heartbreaking time. So I was very appreciative of your role in getting the vaccine rollout. You know, as vaccine uptake increased, that's where we did see, admissions to ICU starting to go down. We saw mortality starting to go down. And I thank you for your role in that. And it really did highlight the importance of building, trust in the medical community, because there was a loss of that from many sources, some reputable, many not. So the approach you took to increasing trust in in public health and public health recommendations, how are you planning to use the strategy? Like, what are some of the strategies you used in Manitoba that you plan to use nationally for increasing trust in this?
Thank you, MP, for your question. Building trust is fundamental to the work that I want to do in this new role. We did see a loss of trust for a variety of reasons, and what I want to do is think about it in many different ways. So speaking more directly to my role, as I mentioned, one of the things that was made very clear to me from Manitobans was the importance of transparency, but also of humility, and being able to share when I know things, when I don't know things, and why we're making the decisions that we are. But I also know about the importance of having a trusted relationship. And that's something that I want to support from the federal level for the frontline healthcare providers who have that existing trusted relationship with patients, with communities, as well as working with community leaders, religious leaders, all of those individuals who already have those existing trusting relationships, so that we can give them the tools, the information that they need to help support their communities, to help support those interactions. Because I know that no matter what I say at the federal level, what somebody with that trusted relationship says is always going to be the most important thing. People rely on their care providers, rely on their friends and family for advice. And so we need to be thinking about it at the national level, all the way down to those individual patient interactions.
Olson.
All right, thank you. Can you think of any specific practices or specific partnerships that you developed in your role in Manitoba that you can apply nationally in this role, particularly in regards to increasing vaccine uptake?
I can think of a number of examples that were helpful during that time. One of the most successful aspects was actually the work that we did by partnering with Indigenous health experts. So in Manitoba, we saw lower uptake within Indigenous populations of the vaccine initially, but once Indigenous health experts were brought in and really led the rollout for Indigenous communities, we saw a dramatic increase in uptake, which I believe was a combination of improved access as well as having that trusted face who is familiar with the circumstances, familiar with the cultural aspects, familiar with the challenges faced by those communities. And so being able to ensure that we do have people with lived and living experience, that we have trusted leaders involved, is a strategy that I would take into this current role. Because I know that I will never know as much as a community leader does about their community. And so I want to develop those relationships across the country to help support community leaders and frontline healthcare providers to be able to support their communities and patients.
Honourable Member.
Okay, thank you. Yeah. Something you said very resonated with me. My career is as an emergency physician, and it is much of the same where you say, we know what we know. We know what we don't know. If we're doing a resuscitation, we know that. Does the patient need an angiogram? Well, we might not know that. This is why we call the cardiologist. So it is very important to know, when to make that. So I think that is important, and that's part of the humility that builds the trust to say, I don't know. We will find out from those who do. And we've been talking about the particularly challenging decrease in vaccine uptake. And I believe Manitoba for some time now has been number one for cases of measles in Canada. It might even be number one for measles in North America. What is your approach to these areas, to these regions? Like, how can this be applied nationally to increase uptake in these particularly problematic regions?
Thank you so much for that.
You have 13 seconds.
I think the partnerships with provinces and territories is critical to that work because while we can come up with national standards and guidelines, the provinces and territories are going to have much more information about what is effective in their communities and the needs of those communities.
Thank you, Dr. Reimer, and thank you, Dr. A. Olson. We will go to Mr. Blanchett Jonka for 6 minutes. Please go ahead.
Merci, Monsieur le Président. Je salue Madame Reimer.
Thank you, Chair. Hello, Ms. Reimer. I'd like to congratulate you for your position. So you started this job on April 1st. I'd like to understand what you have done since to assess the impacts of the closure of the Longueuil Laboratory on public health. The closure was scheduled for April 2026. Now it's been delayed until April 2028. Since you assumed this position, have you taken steps to make sure that there is no public health risk?
Merci, député, pour la question.
Thank you for the question.
Of the laboratory falls under the CFIA and their decision making, and so I have not yet had an opportunity to meet with my CFIA colleagues, but I do know that the CFIA and the Public Health Agency of Canada work very closely together, and this is something that we will continue to work with them to ensure that any changes in the process that they have for the work that they do, that we are partnering and providing that advice to them regarding any impact that may exist for public health.
Remember.
Madame Reimer, juste comprendre, est-ce qu'à votre...
Mr. Reimer, just to understand, do you think that there is an independent assessment of public health in connection with this decision?
Thank you so much for the question. That is something I would have to take away, as it has not been, it's not something that I am directly responsible for, but I would be happy to ask the agency if there has been any involvement in that decision making from us and bring that back.
Honourable Member.
À votre avis, est-ce que la perte d'une expertise...
In your opinion, the losing allergen analysis expertise, could that have an impact on public health in Canada?
When I think about the work of the Public Health Agency of Canada and think about public health in general for Canadians, there is always a need for more expertise, and we always function in difficult resource settings in all levels of public health. And so while I will always value additional expertise, the specifics of the lab closure are not something that I can comment on.
Remember.
Dans les choix de réponse, Madame Reimer.
So the answer I was expecting was yes or no. Do you think that there's a risk?
Dr. Reimer.
Yeah, no, and certainly I understand that. I'm not sure that I have a simple yes or no answer to that question, because all of the ways that we do laboratory sciences are complex and they're shared across different labs. And so I don't think I'm able to give a simple yes or no answer to something that does require an analysis of the laboratory structure as a whole.
Honourable Member.
On va tenter de garder ça simple, Madame Reimer. Donc,
we'll try to make this simple. On April 24th, the federal government decided to delay the closure of the CFIA lab in Longueuil until 2028. Were you consulted before the announcement was made, after it was made? I'm just trying to understand the logistical decision-making process, because it's a public health question, but also a food safety question.
Yeah, I would have to take that away and again ask the agency what their role was, if any, in consultation with the CFIA in that decision making. I don't have that answer right now, but I am happy to ask the agency and bring that back.
Honourable Member.
Monsieur le Président, les réponses qu'on vient d'entendre.
Mr. Chair, the answers here show that there's a lot of uncertainty. That is why I'm going to move the following motion so that the committee can get more information with regard to the potential risks. So, pursuant to Standing Order 1081, the committee asked the Public Health Agency of Canada in the next 28 days the following documents, unredacted format. 1, all analysis of public health, preliminary and final versions on the impacts of the closure of the Longueuil lab. 2, all public health risk analysis related to marine biotoxins, as well as emergency response capacity. 3, all assessment of system capacity to respond to these incidents, 4, all internal and external communication directly or indirectly tied to this decision, including emails, briefs, and all kinds of other information and exchanges with the CFIA, Health Canada, and the Cabinet. 5, the list of agencies potentially impacted by the closure of this lab, as well as a complete chronology, including all assessment available at the date of March 12th, 2026, and reports leading up to the announcement on April 24, and that all of this information be transmitted to the clerk of the committee and to members of the committee.
Thank you, Mr. Blanchett-Jonka. Madam Clerk is trying to distribute the motion to the members. Madam Clerk, is it been distributed?
That's what I'm doing.
Okay. Should I suspend for a few seconds?
Yes,
No? Continue? Okay.
Sure, we'll talk about it. And I want to thank
No,
again.
but not you. But I have it. Ms. G is on the list first before I.
Oh, I thought you were looking for speakers.
No. Not suspend. Mean the motion until the motion gets circulated.
Yeah, talk about it. Okay. I thought you were looking for
No.
speakers. Well, it's because you said suspend. So, okay.
No. Okay. The motion is distributed. Okay. So the floor is with Madam Chi, and then I'll go to Mr. Mazier, and then Konas.
Thank you, Speaker. Oh, sorry. Thank you, Speaker, and thank my colleague for bringing forward the motion. We do have witnesses here. This is only the first round of questions, and out of respect for members who are in queue to ask questions, it's the first time we get a chance to ask questions to Dr. Reimer, and she's doing fantastically. I would really appreciate the opportunity for us to finish the witnesses, and so that members here can get a round of questions, so that it's fair for every single party. So with that, I move to adjourn the debate.
Clerk, take the vote, please, on this.
Ms. Chi,
Yes.
Mr. Ellison,
Yes.
Ms. Jaczek,
Yes.
Mr. Ainley,
Yes.
Mr. Grant,
Yes.
Mr. Rana,
Yes.
Mr. Bailey,
No to the Liberal cover-up.
Ms. Conans,
Another Liberal cover-up, I vote no.
Madam Konas, honorable members, if we can focus yes or no, because that is the answer. I mean, I don't want all these preambles.
Point of order.
There's no point of order accepted. Carry on the vote with
Mr.
Madam Clerk.
Mazier,
Madam,
Sorry, but they have answered.
Madam, sorry, I'm sorry to cut you off, Madam Konas. There is a vote going on, and I will give the floor to the clerk.
Mr. Mazier,
No to the Liberal cover-up.
Mr. Strauss, no. Monsieur Blanchet-Jonca,
Non à la censure.
Okay, the motion to adjourn the debate is carried. The floor is back with Mr. Blanchett-Jonka for 2 minutes 14 seconds.
Juste clarifier, Monsieur le Président.
Just to clarify, Mr. Chair, how much time do I have left?
Minutes and 14 seconds.
Merci beaucoup. Donc, Madame Reimer, je poursuis mes questions.
Thank you very much, Ms. Reimer. I'll continue. Of course, there are many large pharmaceutical companies. Was PHAC consulted on the functioning of this new working group established by the government recently?
You to clarify which working group you are referring to?
I'm going to stop the watch and give it back to Mr. Blanchett-Jonka.
Merci, Monsieur le Président. Donc, le gouvernement.
Thank you, Chair. So the government has created a working group on pharmaceutical products and life sciences last March. I'm just trying to understand if PHAC was consulted.
Okay, thank you so much for the question. Any consultation would have occurred before I began in the role, so that is something I would have to ask the agency, as I would not have been part of that at that time.
Honourable Member.
Madame Reimer, est-ce que vous trouvez normal que les...
Ms. Reimer, do you think that it is normal that the pharmaceutical industry is at the table, but there's no representation from independent experts or patients groups on this committee?
Reimer.
Again, I'm sorry, can you clarify the question?
The watch and Mr. Blanchett Janka, go ahead, please.
Merci, Monsieur le Président. Je comprends que c'est...
Thank you, Chair. So I understand it's not necessarily easy to answer. So the committee consists of only representatives from the pharmaceutical industry. I'm just trying to understand if you think that the composition of the committee, which is not balanced, could compromise potentially the rights of or the opinions of patients, groups, or independent experts who are not at the table.
Thank you so much for the clarification. Regarding the committee, this is not something that is within my mandate, and so I am very happy to speak to other issues, but I don't have the background to be able to speak to that committee specifically.
Honourable Member.
D'accord. Combien de temps, Monsieur le Président?
How much time?
Merci beaucoup.
Thank you very much, Ms. Reimer. The government had an economic update this week, and they talk about food safety, affordability, food production. But they're also talking about cutting down on operating expenses. Has PHAG assessed potential impacts on public health if some of the resources were to be scaled back or cut down?
And Dr. Reimer.
Thank you so much. My understanding is that some of the previous financial commitments for the running of the Public Health Agency of Canada were reinforced in this economic update. However, the agency did go through the workforce adjustment prior to my taking on the role, and so that is something that has already occurred in the agency with respect to their budget.
Thank you, Mr. Blanchett Janka. We will go to the next round, and we'll start with Mr. Mazier for 5 minutes. Please go ahead.
Thank you, Chair, and welcome, Dr. Reimer. Congratulations on your new position and Canada's Chief Public Health Officer. Good for you. So I'll start with a simple question. Is consuming illegal fentanyl safe? Yes or no?
Dr. Reimer.
Thank you so much, MP, for the question. The toxic drug crisis is a complex situation, and it requires a complex response.
It was a pretty simple question. Is consuming illegal fentanyl safe? Yes or no?
Dr. Reimer.
No, while I understand the question, I do believe that it is a complex question that requires a more complex answer, which I would be happy to provide. But
you can't.
Let her finish first. Mr. Mazier, I have stopped the watch. I would ask Dr. Reimer to finish off, and then we'll start the watch. Okay, go ahead, please, Dr. Reimer.
The consumption of any medication, drug, illegal or legal, is.
That wasn't the question, though. Like it was a very simple question. Like
I'm not going to stop the watch. Then go, Mr. Mazier.
Okay. Dr. Reimer, you said in a reference to vaccine implementation during the pandemic, and I quote, "The science changes every single day, so we're having to flip our approaches all the time," which, end quote, which I guess we all heard that and we all lived through that. So does the same principle of changing science apply to supervised drug consumption sites and safe supply policy?
Dr. Reimer.
Well, I think that's an excellent question because it highlights the scientific method and the importance of always evolving our knowledge in regards to any topic.
Said it, honourable members. I have stopped the watch. Let be respectful to her and let her finish. And if you don't agree, then I will stop the watch when the turn comes to you. And if okay, Dr. Reimer, go ahead, please.
So as you mentioned, MP, during the pandemic, the information was evolving very quickly, more quickly than we are typically used to in scientific advancements because of so much attention on that topic. When it comes to other topics like supervised consumption sites, I also anticipate we will continue to learn and evolve as the science evolves, and that is something that we will always need to apply to our approaches.
Dr. Reimer, if you can look at the hand, once they raise the hand, if you can quickly wrap up the answer, that way that will help me managing the committee in a cordial manner. So I will start the watch and we'll go to Mr. Major. Please go ahead.
Are you aware of the new peer-reviewed evidence published in the Addiction Journal showing that supervised consumption sites, when shut down, show no increase in mortality or ER visits, and in fact result in an increase in people accessing treatment services? Yes or no?
Dr. Reimer.
There are multiple studies that are published every day on these topics, and so I'm not aware of what specific study you are referencing.
Mr. Major.
So will you commit to review the government's supervised drug consumption site policies?
Dr. Reimer.
Supervised consumption sites do fall under the mandate of Health Canada. However, it's very important for me as the Chief Public Health Officer to be partnering with them, reviewing evidence, and working alongside them in our response.
Yeah, because like, I mean, you did refer to the opioid crisis and one of your mandates and one of your interests. Like so just so you're aware of what you're walking into when you start reviewing the drug consumption site policies. Like right now, Health Canada is advertising to minors. So you can be 16 years old and up and actually walk into a drugs consumption site and watch an adult watch you consume illegal fentanyl right in front of an adult. That is approved by Health Canada right now. So, and then also there's no ID required as well. So if you could look into those two requirements, and I think you would agree that those definitely need to be looked at.
Dr. Reimer, if you want to respond.
I look forward to reviewing the approaches of Health Canada alongside the approaches of all of the provinces and territories in the work that I take on as Chief Public Health Officer.
Honourable Member.
And in what situation is consuming illegal fentanyl safe?
Dr. Reimer.
So as I had mentioned, when it comes to all substances, whether legal or illegal, there are risks associated with all of them. And so when we are working in hospitals, when we are working with illegal drugs, we are always trying to provide the best possible, safest options for people.
So what would you tell a minor? What would you tell my child or my granddaughter? That fentanyl is, would you say that using illegal fentanyl is safe?
I think that the toxic drug crisis is a complex issue of which supervised consumption is one area that we need to use in our response, but it goes together with prevention, with treatment.
Honourable Member.
I honestly can't believe you can't answer that. Why can't you answer that question? Like, it's like fentanyl, we all admit it's a terrible drug. It's ravaged our streets. It's torn apart our communities. And it's government policy that's enabling it. It's enabling these consumption sites. Actually, our health minister, they can do it at a stroke of a pen. Why won't you admit that using fentanyl next to children is not good? It's not good for the Canadian public. It's not good for our families. Why won't you admit that?
The time is up. You can short answer if you wish to. Otherwise, we will move to the next speaker. And Dr. Reimer?
It is a complex issue, and I believe that the answers require complex responses.
Thank you, Dr. Reimer, and thank you, Mr. Major. And we will go to Ms. Chi for 5 minutes. Please go ahead.
Thank you, Mr. Chair, and thank you, Dr. Reimer, for coming in today to provide expert witness and testify in front of committee. And congratulations on your appointment. So recently, CMA commissioned a survey for Canadians, and they found that 43% of Canadians are highly susceptible to misinformation. And we've seen a lot of various trends online, and it's quite concerning for any generation. And you have done a lot of work in this. You have a lot of expertise in this. I just want to pick your brain on, the type of strategies that you believe are most effective in countering misinformation, especially online misinformation.
Thank you, MP, for your question. There is very clear harms associated with mis and disinformation. The survey that you're speaking about did demonstrate some of the harms that Canadians do experience when it comes to mis and disinformation, and so it has been something that I care a lot about, and one of the topics that I hope to bring into this mandate as a priority for the work that I do. And I believe that when it comes to responding and mitigating mis and disinformation, that it needs to happen at multiple levels at the same time. So what I see as my specific role will be sharing transparent, evidence-based, easy-to-understand information with Canadians. But I think it is equally important that the agency be supporting provinces, territories, municipalities, communities, Indigenous groups, so that they also have the tools and information that they need to be able to support their communities. And so that is as important, if not more important, than the work that I will do at the national level because of the relationships and the specific knowledge that they have about their own communities, the information that they're being faced with, and the needs that they have.
Thank you. Thank you, Chair, and thank you, Dr. Reimer. I'll be sharing the remainder of my time with Dr. Henley.
Dr. Henley, you have 3 minutes.
Thank you, Mr. Chair. Thank you, Dr. Reimer. I want to add my congratulations to your appointment, particularly you being appointed as a public health physician, and. I want to continue on more or less on the same subject. We're in a very challenging time of health information. We often see that political viewpoints and values may override the influence of expert opinion. We're even seeing that within this committee, for example. But I think we're also seeing in south of our border, we're seeing, for instance, changes in leadership at the CDC, where Canadians, North Americans in general, but Canadians also look to that leadership and health information. So in navigating this more difficult world where disinformation is a daily reality, how do you envision pulling in civic society, really? I see this as a real pan-societal effort with your leadership and other health leaders to enable citizens to be able to distinguish good information from false information.
Dr. Reimer.
That question, and I would agree that this is a major issue that is impacting people as they are trying to make the best decisions they possibly can for themselves, for their loved ones. I have personally, as a physician, had patients who have made decisions based on misinformation that has caused them to turn down life-saving or serious treatments and remedies that they needed. And so it's something that I want to bring into this role, but I would agree with the premise that we need to make sure that we are working at multiple levels, and that includes working with people who are at the front lines, the healthcare providers, but also working with patient groups, working with religious organizations, working with community leadership, Indigenous health experts. There are many different groups that we need to be partnering with as we try to fight against mis and disinformation, because we know that there is an onslaught of that. We know with social media that we have little ability to control the algorithms and what people see when they go online. But we also know that those trusted relationships with friends, family, community members can make a big difference. And so I want to be part of sharing information at the national level while also supporting leaders in their communities so they also have the information that they need to support their communities.
5 seconds, Honourable Member. Thank you very much, Dr. Henley. So we will go to Mr. Blanchett Jonica for 2.5 minutes. Floor is yours.
Thank you, Chair. I'll continue with Ms. Reimer. I would like to come back on the composition of the Pharmaceutical Products and Life Sciences Committee. In your opening remarks, you said that you would put the emphasis on transparency and humility in your actions, in your decisions. So the government hasn't made public the composition of this group online. You only have the 2 vice chairs. Do you think that this is transparency coming from the government, who they are not putting the composition of this committee online. It took parliamentarians asking questions to ministers to find out.
Merci, député, pour la question.
Thank you for the question.
I do not have the background in this committee. This is not something that falls under my mandate, but it is a question that I can take back to the agency to see what involvement they have had in the development of the committee.
Remember.
Madame Reimer, pourquoi vous pensez que le gouvernement...
Ms. Reimer, why do you think that the government is hiding the composition of this Pharmaceutical Products and Life Sciences Committee?
Reimer.
Unfortunately, as I mentioned, I don't have the background regarding this specific committee, so this is something that I would have to look into and come back.
Honourable member.
Est-ce que vous comprenez que ça serait pertinent?
Do you think that it would be pertinent for the Public Health Agency to provide an opinion before the members were included on this working group?
Reimer.
Critical that the Public Health Agency of Canada partner with all other parts of government that deal with health-related issues, and so whether that's pharmaceuticals or CFIA or Health Canada, that these partnerships are important to the work that we do, and I look forward to those partnerships as I learn more about the role, about the agency, including this committee.
Honourable member.
Merci, Madame Reimer. Écoutez, je pense
Thank you, Ms. Reimer. I think it's important that parliamentarians are made aware of the opinions of the Public Health Agency of Canada. So, Mr. Chair, I will move the following motion to get information and analysis from the agency to make sure that we have transparency. Pursuant to Standing Order 108.1, the committee ordered the Government of Canada to provide the following documents in the following 21 calendar days. 1, all analyses with regard to the composition of this working group on pharmaceutical products and life sciences. 2, all documents showing the implication, consultation, or the validation from PHAC with regard to the composition, mandate, or the working of the group. 3, all assessment of risk with conflicts of interest and the balance between industry, patients, independent experts, and provinces. 4, all internal and external correspondence with regard to these elements and communication between Health Canada and the Cabinet. 5, all documents showing the participation of patients, independent groups, generic and biosimilar producers, and representatives of provinces, including Quebec, that these documents be provided to the clerk of the committee and all confidential information be provided to members of the committee under seal.
I have 2 speakers on the list, Madam Chi, then Dr. A. Olson.
Thank you, Speaker. And again, I think that my... Oh, sorry. Thank you. I'm so sorry. Thank you, Mr. Chair. Because you look so honorable and great in your seat, so
You're very kind.
I appreciate the honorable member for bringing up the topic of pharmaceutical sovereignty, because we have many good conversations about it, just between member to member, and he also knows this is a great interest of mine. So I actually really appreciate his interest on the subject. That being said, we are on the topic of asking Dr. Reimer in committee. So I understand, although it's been delayed. The pharmaceutical sovereignty study has been delayed many, many times. I know a meeting is coming up, and so we're happy to review the motion that we haven't seen yet and bring up to the meeting at the appropriate time. With that, I move to adjourn the debate. Thank you.
Thank you. Clerk, take the vote to adjourn the debate, please.
Ms. Chi.
Yes.
Ms. Edson.
Yes.
Ms. Jaksic.
Yes.
Mr. Rada. Mr. Grant. Mr. Henley.
Yes.
Mr. Bailey.
No to the Liberal cover-up.
Ms. Conans.
No.
Mr. Major.
Like he's normalizing it. No.
Mr. Strauss.
No.
Mr. Blanchet-Jonca.
No.
Carried.
motion to adjourn the debate carried. Back to Mr. Blanchett Jonka. You have 13 seconds to finish.
Merci beaucoup, Monsieur le Président. Encore une fois, on a une preuve aujourd'hui que le gouvernement ne veut
Thank you,
pas.
Chair. This shows that the government does not want to be transparent because we are adjourning debate, not for the second, but the third time, and the committee has the right to know who has influence on the committees from the government. So I would like to keep on doing my work as being transparent for the government.
Blanchett Jonka, you have 15 seconds over, so thank you kindly. Appreciate this. And now I'm going to go to the Honorable Member Konaz for 5 minutes. Please go ahead.
Thank you. Thank you, Chair. Dr. Reimer, you were quoted by CBC in April 2019 as saying that drug consumption sites certainly reduce risks of overdose and connects people to the system. We've heard a lot that these consumption sites exist within a continuum of care. But these sites, I'm sure you know.
Point of order. Stop the clock. The clock just came, or the camera just came over to Ms. Konaz. I wonder if she could start from the top again.
Thank you for noticing that.
Just a minute. Hold on. Let me reset the watch.
Okay.
Thank you.
Thank you. Okay,
So they actually
Madam
went
Ko-
they went to you first. They went to
Okay, Madam, ready?
Yes,
Madam
thank
Kon-
you, Chair.
Okay, we'll restart from the top. Okay, go ahead, please.
Dr. Reimer, you were quoted by the CBC in April 2019 as saying that drug consumption sites certainly reduce risks of overdose, connects people to the system. We've heard a lot that these consumption sites exist within a continuum of care, but I'm sure you know, in your role, that these sites often exist in places where recovery methods are not accessible at all. And even though drugs are very available, I've been told in my region it would take 2 years for a recovery bed to open up to an addict who wanted to access it. In rural areas, this is what happens, as you know, I'm sure. Do you believe in the theory of consumption sites, and do you believe that they're really working if treatment centers, detox beds, and mental health supports are not accessible for recovery, especially in rural areas?
Dr. Reimer.
Thank you, MP, for the question. I think it does highlight the importance of looking at all aspects of our response to the toxic drug crisis.
So do you believe that drugs should be distributed in consumption sites if these supports are not available?
As a public health official, I would like to see investments into all aspects of care for people who are struggling with drug use.
So, yes or no, do you believe that these consumption sites should be available if no supports are available, as in many rural areas?
Dr. Reimer.
So it's important that we look at all aspects of the response to the opioid and other toxic drug crisis at the same time and make sure that we have investments so that people have access to treatment, harm reduction, and prevention.
Dr. Reimer, I ask because as a British Columbian, in the last decade, we've seen more drug consumption sites and more overdose deaths. But you know that, of course, in your leadership position. Advocates for these sites deny that these two numbers are connected. More overdose deaths with more consumption sites. I appreciate that the deaths aren't happening on site, but they are happening, and more often than a decade ago. So as Canada's new public health officer, in your leadership position, do you see any correlation between more sites and more overdose deaths?
The overdose deaths are tragic for the families who are experiencing it, for everyone who is related to someone who has gone through that. One of the things that's been encouraging.
I will let you finish. I stopped the watch.
Okay. One of the things that's been encouraging is that we've recently seen a small decrease in overdose deaths across the country. And while that is small, it is encouraging for the first time in a while to see the numbers moving in a good direction. And then we need to continue with the complex response to the complex problem.
Reimer, what should I tell the people in my communities where people are dying of overdose deaths, and what should I tell the people that are on the streets who want support and are getting drugs off the street, want support, but have no support? What should I tell them? What's the message that you want me to bring to them as in your new leadership position?
Reimer.
In my position, I look forward to working with Health Canada, to working with the provinces and territories to improve access to treatment, to prevention, and to harm reduction, because they are all critical in this response.
Okay. Dr. Reimer, would you table your notebook that you have there, your reference binder? Yes. That would be fantastic. Thank you. And I'm going to cede the rest of my time to Dr. Strauss.
Dr. Strauss, please go ahead. You have a minute and 6 seconds.
Thank you, Chair. Dr. Reimer, I just wanted to return to Mr. Mazier's question, because I was honestly just really surprised by your response. So I'm like you, I'm a physician. I have been a public health officer. And if either a patient or a young person in my life asked me, is it inadvisable to inject illicit substances, I would have no hesitation saying, yes, it's inadvisable. You could die. You could get infected endocarditis. And I can say that with compassion. I'm worried about that person, and if they feel like they might inject anyways, despite my advice, I'd urge them to get on methadone treatment or something like that. Why do you not feel able to make that recommendation with reference to our previous chat about building trust in public health institutions?
Dr. Reimer, 20 seconds to respond.
Thank you, MP, for the question. I think the importance in my response is that it is a complex response, and I want to be able to provide a more fulsome answer that includes the risks and benefits and how we can reduce harms in my response.
You have 5 seconds to.
I was able to give my response. It took 20 seconds. I don't know why you couldn't, and I'm terribly curious to know what you think the benefits of injecting illicit fentanyl is. Thank you.
Thank you very much, and we will go to Dr. Zez for 5 minutes. Please go ahead.
Thank you, Chair, and congratulations, Dr. Reimer, on your position. And obviously your background has great experience for this particular position. And I remember meeting you when you were president of the Canadian Medical Association as well. So I'm sure you have contacts across the country as well as you assume this new role. I'm going back to early 2020. I was a member of this committee when COVID-19 was declared a pandemic, and we were very distressed to discover that the stockpile in terms of pandemic preparedness had become obsolete. A number of items had expired. Have you, in your new role, had the opportunity to check out the situation? Obviously, we know we will face another pandemic at some future time. So what's being done in terms of pandemic preparedness, the stockpile, etc.?
Dr. Reimer.
Thank you so much for that question. The Public Health Agency of Canada learned a lot of lessons through the pandemic, and when it comes to emergency preparedness, that is an area that is a high priority for the agency and something I look forward to participating in. So, for example, there has been a lot of efforts that have gone into the stockpile, into ensuring that we do have access to medications, to non-medical supplies, and that they are kept up to date and monitored on an ongoing basis. I know that there have been emergency preparedness plans that have been created across the government, and that the Public Health Agency of Canada has been part of that work as well. And so I have had an opportunity to be briefed just as an introduction to the work of our emergency stockpile, but I do look forward to having the opportunity to delve a lot deeper to understand what supplies we have, where there may be gaps, what we can do better, as well as making sure that we're working with our partners in the provinces and territories, because I know that we had similar issues issues in the provinces and territories during the pandemic where stockpiles some had expired, and so making sure that we continually invest in preparedness is something that's going to be very important for health security in Canada.
And in terms of surveillance, obviously, as we potentially await the next pandemic, are you familiar with the ability across provinces and territories to gather the appropriate data from laboratories, etc., to know if we were suddenly facing incidents of a new virus or whatever? Have you been able to liaise again with provinces, laboratories across the country, etc., to assure yourself that we are monitoring the situation here in Canada?
Dr. Reimer.
For that question, because it gives me an opportunity to speak about something that I think the agency does very well, and something I was excited to participate in, and that's the ability to convene experts and collect information and share that information. So in Canada, we have reportable conditions where all the provinces and territories have to report up to us to let us know when these conditions are occurring in their jurisdictions. Likewise, we share information with other countries about reportable conditions or new infectious diseases of concern that occur, and those conversations are happening on an ongoing basis. Even before we've had confirmation, we do have shared information between different countries about things that we are seeing, so that we can be aware of potential risks and threats that may be developing. And so as we continue to do this surveillance, this is going to be an ongoing critical part of our emergency preparedness, that we not only share with Canadians the information, but also be working with our public health counterparts across the country, so that all of us are aware of what is being seen in the different regions and can prepare accordingly.
Honourable Member.
How much time do I have?
You have 45 seconds.
Just a little bit of a follow-up on surveillance. What role is the World Health Organization taking in terms of perhaps warning countries about something that's occurring across the globe?
The World Health Organization is an excellent organization to be able to share up-to-date information about what is being seen across the country. And in fact, I will have the opportunity to be at the World Health Assembly in May in Geneva, and that will be an opportunity for me to meet with my colleagues from other countries and to learn about the partnership that we have and the role we have in Canada at that international organization, and be able to take it back to Canada and, if as needed, to this committee as well, and share what I've learned from that experience.
Thank you, Dr. Jazik, and Dr. Reimer. Congratulations on your new role, and thank you for sharing the valuable information with the honorable members. With that, we are past 2 hour mark, so will of the committee to adjourn the meeting? No? Yes. Okay, adjourn. Meeting adjourned.